Welcome DEKWP, Xiaogong Abor. Your learning journey starts now. Right, let's jump straight into the deep end. We're looking at the big names shaping proactive medicine. Think of it as healthcare on steroids, not just reacting when things go wrong, but predicting, preventing, personalizing care, getting everyone involved, and using data like never before. It's a massive team effort, pulling together folks from all sorts of backgrounds. Okay, let's meet the tech wizards and digital trailblazers. First up, Eric Topol, a cardiologist who's basically a rock star for using tech in medicine. He wrote Deep Medicine, which argues that AI should be about helping doctors and patients, not just automating tasks. Then you have Fei-Fei Li, a giant in AI, especially making machines see like humans, super useful for spotting things in medical scans. Andrew Ng, he practically put deep learning on the map for healthcare with projects like ChexNet, an AI that reads chest x-rays. Regina Barzilay is another powerhouse. Her AI work helped predict breast cancer risk earlier, and she's also finding new uses for old drugs. Mihaela van der Shah is tackling the really tricky part, making AI predictions truly personalized for each patient. And Leroy Hood? He literally coined the term P4 medicine: predictive, preventive, personalized, participatory, the very DNA of this proactive approach. We also see pioneers like Edward Shortliff, who built some of the first AI systems to help doctors make decisions, and pioneers like Gunther Eisenbach, who championed open access to digital health research. Notice the recurring theme: using AI and data smartly, ethically, and always keeping the human patient at the center. Now, let's talk about the architects, the people who aren't just building tools, but designing the entire blueprint for proactive healthcare. Leroy Hood again, because his P4 framework is fundamental. Yukong Duan introduced the DIKWP model. Think of it as a ladder. You start with raw data, climb to information, then knowledge, then wisdom, and finally, purpose. It's a powerful way to think about how we use health data meaningfully. Luciano Floridi brings in the crucial philosophical angle, asking how do we make sure AI in healthcare is fair, ethical, and truly benefits humanity. Edward Shortliff and Peter Solovitz laid the groundwork for how computers can understand and reason about medical knowledge. Mark Musin built the tools, like Proj, that allow different AI systems to share and understand information. Vimla Patel looks at the human side: how do clinicians actually work with these AI systems safely and effectively? Amit Sheth wants to build giant webs of knowledge, connecting everything we know about health. And look at the global players: Victor Zhao pushing AI strategy in the US, Soumya Swaminathan shaping WHO guidelines, Tan Chor Chuan building Singapore's national health platform, and Margaret Chan, who pushed big data, thinking globally. These folks are building the theories, the frameworks, the policies, the very structure of proactive medicine. Alright, let's get into the nitty-gritty. How does this actually work in practice? How do humans and machines team up? Marco Visconti is building virtual humans inside computers, simulating diseases to test treatments before they hit patients. That's an in silico trial. Rosalind Picard is working on wearables that can sense your emotions, potentially catching mental health issues early. Feiyue Wang talks about parallel medicine, where real-world doctors and virtual AI systems work together constantly. John Halamka is building platforms, like digital marketplaces, where AI tools can connect with hospitals and developers. Enrico Cuellar focuses on the crucial communication between doctor and AI, making sure it's safe and effective. Patricia Flatley Brennan thinks about how patients and families can use AI tools at home. Lucila Ono Machado tackles the thorny issue of sharing data securely between hospitals using clever techniques inspired by blockchain. Suchi Saria built Trues, a system that actually sounds an alarm in hospitals if sepsis is brewing, giving doctors precious time. Franciscus Martino is making surgery robots smarter with augmented reality. Dominic King led the development of Streams, an app used by UK hospitals to catch kidney problems early. Michael Snyder famously showed that wearing sensors constantly could detect illnesses days before symptoms appear. Eva Lee uses AI to optimize complex treatment plans. Even Hans Rosling, known for making data understandable, fits here. And look at the industry leaders. Omar Ishraq connecting pacemakers to the cloud for remote monitoring. This is where the rubber meets the road, building intelligent systems that genuinely help humans. Finally, let's recognize the heavy hitters, the scholars whose research has had a massive impact, driving the field forward. Eric Topol, again, because his influence goes beyond research, he shapes the conversation. Regina Basile's work on cancer AI is groundbreaking. Atul Butte shows how sharing data openly can lead to real breakthroughs, like finding new uses for existing drugs. Isaac Cohane has been a leader in bringing AI into academic medical centers. Luciano Floridi's work on ethics is essential for guiding this technology. Jo Agarwal proves AI can make mental health support accessible to millions through her startup, Wysa. Noemi El Haddad showed that data people track themselves can be valuable for health. Marinka Zhitnik is pushing the boundaries of using AI to understand complex biological relationships. David Ferrucci, behind IBM Watson, even though it faced challenges, forced us to rethink AI's role in medicine. Kristen Fortney is applying AI to the quest for longevity. Fei Wang mines vast amounts of medical data to find patterns. Elias Zerhouni scaled up precision medicine initiatives. Sir Michael Marmot reminds us that health is deeply tied to society and policy. Peter Piot and Cameron Kahn are giants in using data and AI for global health security. Dean Ornish proved lifestyle changes can reverse disease, a cornerstone of prevention. Shinya Yamanaka's Nobel Prize-winning work opens doors to regenerative medicine. Vivian Lee and John Maddison built massive data infrastructure. And Ida Sim helped establish mobile health data as legitimate science. These individuals represent the cutting-edge research and the diverse ways proactive medicine is being driven forward globally.